When we talk about quality of life, and I think this is something Kim can speak to, we think about who works at Lancaster Manor. And I've heard the county board say, well, we pay more than private pay. Can you explain that to me?
The wages are higher in your government-run, unionized facilities. That's a normal in any national survey. But that higher pay, those better benefits, also in turn, those people become more dedicated to what they're doing and who they're doing it for, and therefore your quality of care and all the things that you really truly need to give to these residents is there, as opposed to in your private pay. Your people stick around longer. I mean, you look at longevity at the manor and you see people with 25, 30, 35 years of service. And really? You won't see that in your private pay industry. You know, they're going to move on, they're going to look. People look at the manor, hope that there's an opening so that they can come into those wages and those benefits just the same. So. But
it isn't really high pay. I mean, when I was looking at a report that a committee that the board put together, it seemed to me that the certified nursing assistants were making what? 23, 24,000 a year for
Well, I think there's only about a $2 an hour top difference between those positions that they compared to with, I believe, Tabitha
and Milder Manor.
Milder Manor, yeah. There's a couple dollars difference.
So we're talking about typically women who are raising children, and this is how much they're making. So those benefits that they get at the manor are really important. And that it contributes to them staying, and then they get to really know the residents, and it becomes that better atmosphere. Can you tell me what happened, what was it, in the spring with the county board when they formed a committee to look at the manor's status? Can you tell me what happened?
Well, that was a secret committee, basically. It was a group of people that the county commissioners picked and then gave information to decide what the best thing was for the manor. And when that committee had met 3 or 4 times, give or take, they came back and they said that none of the candidates that had put in on the RFQ or the request for qualifications were qualified candidates. And that was based on the fact that none of them would give them a set number of Medicaid beds that they wanted. So they opted to go with the structured sale. And that was how the RFQ committee presented back to the county board. And as it sits now, that whole process has been done away with, and they have gone on and decided that one of these people that proposed to them is who they want to sell to now.
Can you tell us a little bit about the background of the management company that is being considered for the purchase of the manor?
Well, I think all 3 of us can probably contest to that it's got a very bad proven track record.
Can we look that up on the internet? Do we know that as a fact?
Somebody, I believe it was Tina, you said it was on the Channel 10 website.
Yes, all of the information, what the coalition came up with and presented in their latest press release is available on Channel 1011's website as a downloadable item.
Okay. And what you found was that the name of the company is Hunter?
It's Hunter Management out of Evanston, Illinois. I think we took it from 45 nursing homes that we initially put out down to 38 homes that we could verify that they owned in Illinois, or yes, Illinois, Indiana, Ohio, and of these homes, the greatest majority were 1-star Medicare ratings.
And that means that they're poor?
They're the worst of the worst, and Marlene and Tina can answer more towards what the Medicare ratings are and how they are.
Could you explain those to us?
Yeah, Medicare rates their nursing homes on a scale of 1 to 5, where 1 star is the bottom, and 5 is kind of like a hotel, you know, 1 star versus a 5-star hotel or restaurant. And so anybody can go to Medicare.gov and look up any of their nursing homes. the easiest place to look up the ownership of their nursing homes is on the Illinois website for
It's Secretary of State, Illinois.
Secretary of State and the Department of Health and Human Services there. And that's going to be the easiest place to look up those names and make, to verify their ownerships.
Okay. And so this particular company doesn't have a good track record. Have they ever experienced any fines or anything like that?
There's several hundreds and thousands of dollars worth of fines. I don't remember what the last one was. If it was, I remember
over 800,000.
835,000, and that's in a time frame of 2001 through 2009. So it's
Okay.
it's a wider span, but those fines are very. I mean, they're not your minimal $100 or $200 fines. You're looking at 10, 15, 20, 55,000 tops per fine or incident for some of the things that have happened in their homes.
So this indicates poor quality of care. And it seems to me that all of you are very concerned about the residents, that what you're really interested in is maintaining Lancaster Manor as a quality facility for low to moderate income, mostly elderly people to be able to live at.